there's a very strong push by the medical authorities to deny that this phenomenon exists. And so you've got these poor patients that are coming down with these turbo cancers. They've been COVID vaccinated. They'll show up at their oncologist, and their oncologists struggle just to manage the cancer. There's no research being done around this. And that's the other shocking part is that there's just no research being done. And so when these cancers, when they're being managed by the oncologists are hitting it with your standard treatments, your standard chemotherapy regimens, your standard radiation therapy regimens. They fail, the patient dies after a few months, and that's the end of the story. There should be research being done in all of these cases. Why are we struggling with these cancers? What is different about them? And the research is just not being done. Doctors, as I mentioned, doctors are being threatened, implicitly or explicitly. Implicitly, the threat is that you don't do anything that would cause vaccine hesitancy. And so you've got pathologists that are not doing proper autopsies. You've got cancer researchers who are not doing cancer research because they're afraid for their own licenses and for their own jobs. Right now, doctors, and I can tell you, especially in Canada, but I see it happening in the United States as well, doctors right now are just desperate to keep their mouth shut and keep their jobs, keep their academic positions in the universities, because if they speak up, they're being stripped of their academic positions, they're being stripped of their labs. So you've got doctors like Dr. Ryan Cole in the United States, pathologist. They've gone after his lab, pathology lab. Dr. Byron Bridle, virologist in Canada, who actually did the Freedom of Information request that gave us the Japanese study, the biodistribution study from Pfizer, that told us that the lipid nanoparticles are going all over the body and they're depositing in the various tissues. He's been locked out of his lab by his university. And so there's an attack on anybody who tries to do any kind of research. So that's why in terms of the turbo cancers, we are flying completely blind here. And other than Professor Daglish, a senior oncologist in London in the United Kingdom, he's sounding alarm about these turbo cancers. Dr. Ryan Cole in the United States, Dr. Peter McCullough, of course, in the United States, who's at the forefront of all types of vaccine injuries and raising the alarm. And myself, I'm speaking out about it here in Canada, and a few other doctors, other than the handful of us, it's being completely ignored by the medical establishment.
Which to me raises a lot of important questions, but one of which is that if they're denying this, they're, in a sense, they're knowingly allowing people to die. And they're withholding information that could save people. If they put the full force of their research and their grants into developing, say, new ways of treating these turbo cancers, as an example, or if they started to even warn people and make this information public and saying, look, there is a chance that your third booster might cause a cancer that will kill you within a month, right? I think that they are in a position to save people's lives, yet they're not. And this seems to be a theme throughout this pandemic, especially, right? I mean, and even going deeper into history, looking at the history of Monsanto and Bayer and the big pharmaceutical companies. And I mean, it seems like there's a pretty common theme of corruption and profit over human life that takes place at that level. But why do you think these doctors, the hospitals, the medical journals, and then getting into the bigger organizations that I think probably pull a lot of the strings, why are they not acknowledging this? Do you suspect that there is some sort of level of intent to cause harm, or is it about profit because they're going to make money treating these cancers? Or I know it's more speculation, but what do you think might be behind this?
That's a complex question, but you hit the point, I think, which is a key point, in that this vaccine injury denial, which is what it is. It's a complete denial that these things are happening. It's happening across the board with all kinds of vaccine injuries. And so even something as straightforward as myocarditis, where there's tremendous amount of evidence of myocarditis happening in young people, men and women, and then that myocarditis leading to sudden cardiac arrest and collapses, whether you're sleeping early morning hours, as Dr. McCullough points out, you get a bit of a surge of adrenaline, and that seems to be the initiating factor for the sudden arrhythmia that leads to sudden cardiac arrest, or the athletes collapsing in the field. All types of athletes, amateurs, professionals, even doctors who are athletic and who are triathletes. I have 3 Canadian doctors, triathletes, who collapsed while doing some kind of physical activity and died. One of them was an Olympian, 50-year-old Dr. Paul Hannam, an emergency doctor in Toronto, who went for a jog. An Olympic athlete collapsed and died of sudden cardiac arrest, had to be fully vaccinated to keep his job. So there's an overall blanket denial on vaccine injuries, the seriousness of them. And the problem with that is that, and what's so frustrating to me as a physician, and I'm sure to other physicians as well, is that if you're denying the seriousness of a problem, then you're not looking for solutions. And so in the case of myocarditis, we know from various pathology studies that have been published, there was a nice one published in South Korea. They had a 22-year-old military recruit who collapsed and died 6 days after taking a Pfizer shot. They did a forensic autopsy, and they figured out what kind of myocarditis this is. And they said, this is a type of myocarditis we've never seen before. It's very severe. It could be easily missed on autopsy if we didn't do a forensic, detailed autopsy type. And so we are dealing with new pathophysiological processes that are causing these deaths. And these processes, you could potentially prevent some of these things. You could potentially prevent some of the cases of myocarditis and sudden cardiac death, but we need new treatments. And we're not getting them because the medical authorities have this blanket denial on admitting any kind of injury having to do with the vaccines. And so we are already way behind the curve. Who is treating myocarditis, post-vaccine myocarditis? And how are they treating it? It's not being treated. Who's treating the blood clots? Okay, you put them on sort of the basic blood thinners, and they often don't work. And then what? The patient is out of luck, right? Same thing with the turbo cancers. Are we doing anything to strengthen people's immune systems, maybe to make them less susceptible to developing turbo cancers? We're not doing anything. We're not doing any of that. So the medical establishment is basically willfully ignoring these problems with these COVID vaccines